Welcome to the third and final episode of SoulTV.net's investigation into the psychiatric industry. In the previous episodes, we focused our attention on those who believe the psychiatric industry is dangerously out of control and in desperate need of a change. To be fair and balanced in our reporting, we decided to speak with a leading psychiatrist and get an expert view into the other side of this controversial subject.
I think part of the problem is that the patient can abuse and the system can abuse, and we need to focus that there is no abuse of medications in the system, and it is used properly for the right diagnosis and for the right patient.
SoulTV.net invites you along now for the third and final part of the series, Drugging for Profit. This time, the psychiatrist's view.
Present breadth of drug use may be almost trivial when we compare it to the possible number of chemical substances that will be available for the control of selective aspects of man's life in the year 2000.
Dr. Klein spearheaded a movement flooding new psychiatric wonder drugs onto the global marketplace. Backed by a massive publicity machine, spending hundreds of millions of dollars. Psychiatry was now an industry of drug pushers.
You see, the mental illness is still a stigma. People don't know about it. They can talk about, I have diabetes, I have high blood pressure, but the moment they say I have depression, or I have mania, or I have schizophrenia, people are very scared, So to me, from the very school system, I'm very much in promotion of mental health education in high schools so that they know what it is, so that if a teenager is getting depressed or getting anxious or having violent thoughts, that he could go to the teacher, go to the doctor. So I think the education, and as the people get more aware of that, I think they will use the system more responsibly.
There's no such thing as mental disorder. A mental disorder is whatever someone says it is, and if the person saying this is a mental disorder has enough power and influence, then people believe, oh, that's a mental disorder.
It's based on a grab bag of checklists for disorders that are published in a book called the DSM, which is the Diagnostic and Statistical Manual. There are no statistics in this book, by the way. That just makes it sound more scientific.
Maybe there's a misunderstanding about DSM. I think it is just a guideline for the professionals. So if I'm a psychiatrist and I have a patient and he is going to, for example, North Bay or somewhere else, and I'm writing a letter to another professional, so that classification helps us. Rather than 4 pages letter, I say this person is manic depressive, or he is paranoid schizophrenic, or he has, for example, personality disorder. They are not, I think the difference is, it is not a quantitative research, that is in the laboratory. It is a qualitative research where a number of psychiatrists...
Based on individuals rather than based on a group.
It's marketed as a scientifically based document. Now, the American Psychiatric Association, which publishes the DSM, do a lot of work to create an aura of scientific precision around the DSM.
At the moment, the psychiatry is based predominantly on clinical examination. It is based on the family history. So if a person has a family history of manic depressive illness or schizophrenia, and the children or the teenagers show that problem, so diagnosis is more based in the mental health field on a clinical impression of a professional with the help of the family history and all that. So we do not have still a test that will show you that if you go to the Clark Institute and you say what kind of depression, what kind of schizophrenia you have. Hopefully, but this is still far better that 50 years ago we had no basis, no classification, and even the rest of the world, they just say you are crazy, you are sick, you are mad. We don't even have words in other languages for these. So we are very much in the beginning. This science is very much in the beginning field, and in the next maybe 50 years we will develop more.
But Dr. Sohail, really, some people paying the price for being in the beginning stage, for being in the infancy. Because some people paying a price for that. They labeled wrong, they be diagnosed wrong, based on, you said, the DSM book, and they suffer for life.
No, I think the alternative is that you don't have any treatment. I think what I'm saying is that if the person has a responsible family doctor, a family psychiatrist, and get another opinion. So I think it is, what I'm saying is, the same thing can happen in any other medical field. If you have cancer, you have other treatment, and you can be treated with chemotherapy, you can be with radiation therapy, and the diagnosis, when in doubt, in many hospitals they have a group meeting, they have many psychiatrists, they have consultation to do the best you can. So I think we are all human beings and nobody's perfect. But I feel that having a conscientious doctor, conscientious psychiatrist who cares for you, and you feel free to discuss with him, and if you're in doubt, I think sometimes if the communication between the family and the doctor or the psychiatrist has broken down, that might be an issue. But I think if there is a compassionate, caring doctor who has a humanistic attitude, he can tell you, this is my feeling. And the other thing is, even mental illness, it does not, like a medical thing, it's not like bronchopneumonia. It takes time to develop.
As well as being exceptional in the field of psychiatry, Dr. Sohail has received the 2006 Toronto Humanist of the Year Award for his outstanding work and dedication to the humanist cause.
We have been, as a group of scientists, trying to study, try to understand, but our understanding of mental illness, mental health is still not fully as well developed. So there are issues.
We have no diagnostic reliable markers for almost any illness there is in the DSM.
What we're testing for in psychiatry, it's hard to say because there's nothing specifically.
But as far as a test that's clinically useful, basically we're not there yet.
The door is wide open for corruption, for anyone who lost his moral compass to go that way and make tons of money. So drugging for profit is quite possible, because you're only governed by your own conscience. There is no rules.
Yeah, I think that's what I'm saying. So there are two parts. The part is that a medication can only come into the market if it passes the scientific test. So that is one part. For example, you have to prove that Prozac or Zoloft is working for depression. We also have, I'm an immigrant psychiatrist, I also feel that when a drug is tested on one group of people, for example, white Anglo-Saxon, just giving it to Chinese and to Latin Americans sometimes is not fair. We are even questioning that the drugs that should be clear what group it was tested on, so that it is not universal. That's one part. But once it is tested and the national health sort of approves that, now there's a second part. You're marketing it. I feel that these drug companies should also have, for those people who cannot afford, for example, to give that voluntary or human services. But I agree with you that if there are people who, because of the market economy, with their bad conscience, wants to abuse it or wants to make profit, now that is another issue. But the part that I think to me is crucial is that whatever is offered, that the people who are suffering, that should be led by those doctors, those psychiatrists who genuinely care for the family, and family feels connected, that because when you're ill, somebody has to look after your needs, or somebody has to look after you well. So I feel that the trust that the patients have for me or the doctor is very crucial, that you do not feel that your doctor or your psychiatrist or your nurse or your social worker is becoming so greedy or so self-centered or so focusing on their own that they don't care for you. And I think that is a separate issue from that.
Those little pills like Ritalin, Adderall, and Concerta are classified by the U.S. Drug Enforcement Administration as highly addictive substances, right along with cocaine, heroin, and methamphetamine.
When I was on the Ritalin, it made me just feel like totally different, like I wasn't who I was.
I was, flipping out, was twitching, going crazy.
Most of the antidepressants or antipsychotics, they are lithium, they're not addictive. On the other hand, we have to be careful, the medications that are like, for example, Valium. It used to be Valium. People got dependent on that. So I think those minor tranquilizers that people have for anxiety or for sleep problem, we usually prescribe them for short periods, for a few weeks. But if somebody's taking that for months and years, then it is harder to stop or get over that. But still, the prescribed medications, to me, qualitatively are different than when we talk about the cocaine or other things that are street drugs.
So you think prescriptions such as drugs such as Ritalin would be different to cocaine?